My name is Ericka. I work for the Plastic Surgery Center. I am a medical receptionist, and I also am the certified translator for the office, and I am also a patient of Dr. Brown and Dr. Saad's. A little bit about myself is that I am 42 years old. I am a Hispanic. I'm also married for 17 years, and I have 2 children. I have a 13-year-old and an 8-year-old. Some of the symptoms that I was experiencing with my conditions were joint bearing. Like I couldn't bend my knee, it was painful, it was swollen, I couldn't be a certain amount of standing up, I couldn't bend the knee, I couldn't bend down to my desk or even connect a simple plug that you would think it's nothing, that you need your knees for. Those were some of the symptoms that I was experiencing with the joint. Some of the methods that I did try prior to surgeries were injections. They did subside the pain for a little bit, but it wasn't permanently. I went back to even feeling worse, and I was kind of almost saying I need more of the injections because this makes me feel better. You kind of feel addicted to the injections at one point because you are seeking for pain relief. That's not the answer some of the times. You have to be more research about it. Is that at the end of the road, is it going to be helpful for me to keep on getting injections? Or what are the alternatives that I could use to treat, is it exercise, physical therapy? You just have to research and look for what are the other different things that you could try. I wasn't even thinking about surgical solutions at one point because everybody, when you think of surgery, oh my gosh, they're gonna open me up. How many days am I gonna be out of work? Especially when you have a family and kids, you're like, oh, I can't be it. I'm the mom, I'm here, I have to do this, I'm more physical. So at one point it gets to how bad do you want the pain to go away? Is it going to be helpful for your kids? Is it going to be helpful for your family, your work? That's where you decide to, oh, you know what? I think it's time for me to consider seeing a surgeon. How I found Dr. Saad in the procedure is because one day I was walking in pain and limping, and he was like, are you okay? What's going on? And I kind of gave him a little bit of my story that I have seen, an orthopedic surgeon, injections weren't working anymore because I was just getting addicted to getting injections. The best way I could explain the procedure is, they just go into your joints. It's basically the nerve decompression of the joint to relieve the pain that you're having or causing, which it could be your shoulder, your neck. In my case, it was my knee. The recovery was amazing. I was back to work 4 days later, and I was able to, walk, drive. The pain, if you ask me if I had pain, not at all. Yeah, it's typical pain after surgery, but it's nothing that you need pain medications, maybe Tylenol and ibuprofen. Other than that, it was phenomenal. I can't say anything else about it. I would recommend it to anybody because if you have to go back to work or you have an infant or a toddler, you could easily do it. It's not as bad as it seems. How long has it been since my surgery? It's been 3 months. And it seems like not even 3 months because, like I said, the recovery, I was at work 4 days after. I was walking, driving. So the recovery is amazing. I couldn't even describe it any better than, it's the best thing. What advice would I give somebody who's considering joint? First do your research. Not everybody's the same. Just because I healed better, it's always to get a second opinion, especially with your primary care doctor, because he's the one that's going to tell you if it's recommended for you or not, and it depends on the recovery too. Just because I recovered in 3 days doesn't mean that you might recover in 2 days. So it's based on what you feel that your need or it's necessary for you.